Hi everyone. We are here for our first session on Let's Talk Neuro. We are going to talk about managing chronic headaches and migraine during this COVID-19 pandemic, which has been a severe pain point for a lot of ICARN patients. And we have with us Dr. Amit Kumar Pandey, who is a leading neurologist and consultant specialist from Pune, who's been practicing for over 13 years now, and his clinical expertise is in muscle disorders, neuromuscular disorders, brain aneurysm, interventional neurology, and many more. So, welcome, doctor. So glad to
Right.
have you on board.
Yes.
Um, just to give everyone an overview as to why we are doing this neurotalk session, it is estimated approximately 30 million people in India who are experiencing the ill effects of various neurological disorders. Not just headaches, but there's epilepsy, there's meningitis, degenerative disease, over 600 actually. Doctor, correct me if I'm wrong, but I think there are over 600 diseases in the category right now that needs attention from a neurologist, right?
Definitely. A lot more, and we are exploring new every day.
Correct, correct. So, what we've observed is there's a lot of lack of awareness regarding the complexities of these neurological issues. Not only that, our patients, often complain that, because we are not aware, there is a more myopic view towards preventive care also. So, to bridge this gap that we have observed, we would like to educate our audiences more about neurological disorders and the common issues that people are currently facing, right? So,
Definitely.
jumping on to the first question, doctor, how has care for patients with chronic migraine or headache actually changed during COVID 19?
Yeah. Actually, we have been seeing both sides of the spectrum.
Mm-hmm.
People who are very irregular with their dietary schedule or irregular with their sleep patterns are
Mm-hmm.
now at home, and so they are able to manage themselves better. And so this has led to somewhat, in some patients, a few patients, the headaches have gone down. But the other spectrum, we have seen that people have started staying home, binge
Mm-hmm.
watching television, Netflix,
Correct,
some sort of
correct.
TV. Sometimes they are awake for late nights, and because they are
Correct,
home, they are not eating at regular times. And not to
correct.
forget, because they are at home, they are not exercising much. So this has also caused a slight increase in new patients of headaches.
Mm.
So we have seen both spectrums in this period of COVID-19.
Right, right. But doctor, do you think that the care or the way in which the kind of symptoms or the kind of the patients that were coming pre-COVID and post-COVID, is there a drastic difference in
Not with headaches. The symptoms have remained more or less the same.
it? Mm-hmm.
Headache being a chronic disease, only when there is a drastic change in symptom, when it is associated with fever or not, we think about a red flag and something different. But if the
Right,
headache pattern has remained the same as it was previously, then we don't need to chop and pick a new treatment.
right, right. Great. So, doctor, a second question that we've kind of tried to accumulate a little bit about headaches also, just for our readers to see this. Research suggests that about 75% of patients who come to doctors because of headaches will have
Hmm.
migraines, as it's
Hmm.
most commonly underdiagnosed.
Hmm.
Even we've had a lot of cases. I'm sure you're aware that people saying that since 2 months or 3 months I'm having a constant headache. Is it a migraine or is it not?
Hmm.
So,
Hmm.
how do you differentiate between the kinds of headache, and why and when should someone consider something for a migraine?
Uh, Absolutely. Most of the times, the headaches goes unnoticed and undiagnosed as just one-off headache. But many of these
Right.
patients have migraine. Migraine being the most common headache. No, migraine has got a typical feature that
Mhm.
it can vary from duration of 24 hours to 3 days, and it is a throbbing pain on one side. and the side may shift from one side of the head to the other side. And
Right.
people are averse to light, loud sounds, and
Mhm.
sometimes they are also osmophobic. They don't like strong, pungent smells or sweet
Mhm.
smells or
Mhm.
odors coming out of perfumes. So they are very averse to this.
Mhm.
And as it is mentioned in the slide, headaches can last for several hours and up to several days.
Correct.
These
Correct.
headaches have got, sometimes these patients have got something, some aura. They feel light flashing in front of their eyes, and then after
Mhm.
that the headache starts, or they
Correct.
feel fatigued before the headache starts. So
Correct.
these are telltale signs that you are going to have a headache before. So these signs come, and then you say that you are having a migrainous headache.
Correct. Correct.
Other types of headache which we see,
Mhm.
tension type headache, that is daily headache. Those are
Mhm.
daily, they are transient, they occur in office hours
Mhm.
mostly, and they are, as mentioned, present holocranially on both sides of the head. So
Right.
these are milder as compared to migrainous headache. But people who have tension headache, they also feel that they have got migrainous headaches. And the third, which we have mentioned here, cluster type, it is
Correct.
a very rare type of headache, and it is one of the most devastating type of headaches. Patient has got
Mhm.
severe
Mhm.
headaches, and they occur at every. They are short lasting for like 2 hours, 3 hours to 6 hours,
Right.
but they cause intense morbidity, and patient is
Mhm.
totally that
Mhm.
they totally in so much pain that he may sometimes contemplate committing a suicide or something. So cluster headaches are
Okay.
very devastating.
Interesting. I think
Mm.
people should just not diagnose themselves as, having migraines, because a lot of us tend to do that if we are having a one-sided pain and we think, oh, it could be a migraine. I think it's
Yeah,
always, there are so
it
many
is a common.
aspects to it.
Yeah, it is a common saying in the field of neurology. If you
Mm-hmm.
are not having a headache, a migraine headache, then you are not a neurologist. So
Okay.
it is so common
Mm,
because everybody has got this untimely schedules in their day-to-day life, and so they are
right,
prone to headaches. Yes.
right, right. Okay, moving on to a good question, I would say. So, according to you, what would be some practical tips for managing chronic headaches? Because
Uh,
we come across all over the internet that you do yoga, you eat right, you sleep right, etc. But let's
yes.
be realistic. I think COVID has changed that whole gamut of our sleep cycle or our lifestyle, right? So,
Yeah.
what would you say is sustainable, and what sustainable tips would you recommend?
Sustainability is a big thing, nahi? So
Right.
when we advise patients with migrainous headaches or chronic headaches, we tell them to follow this typical dietary schedule in which they at least eat at the same times every day.
Right,
So
right.
even if it is late in the evening or early in the evening, you have to be consistent with your timings. Even
Correct.
while sleeping, you should be sleeping for this at the same times every day. It sets your circadian rhythm in motion, and so everything is
Mhm,
like a well-oiled machine. So it
mhm,
works well.
mhm.
And people often forget this, but they don't drink enough water. So drinking
Right.
about 2.5 liters of water will also help you a great deal. And
Interesting.
people who are averse to sunlight, most
Mhm.
of the patients who are having headaches, migrainous headaches, they go in the bright light and they start having headaches or increase in intensity
Mm,
of headaches.
mm.
They should start wearing dark goggles whenever they are out. So
Okay.
dark goggles need not be very flashy, but simple dark goggles may help them a great deal. And most of the times, these basic tips of eating at regular times, sleeping at regular times, 2.5 liters of water, wearing
Correct.
dark goggles, these help in a great way to decrease the intensity or frequency of your headaches. So about we have found out that about 70% of your headaches are decreased by this only,
Great,
and
great,
helps a great deal. Of
great.
course, so yoga and meditation also play a big part. But
Mhm.
yes, these are the basic things which you need to do always and follow always.
Right, right. Great. So moving on, the next question that I think is something that you might have experienced with, patients
Mm.
experiencing chronic headaches. That's they keep complaining that it's worsening during the pandemic. So I think this resonates with our first question, where the
Yes.
symptoms of the idea is how do you tend to differentiate the symptoms, especially from a neurological perspective, whether it could be a potential
COVID headache.
COVID-19, right? It could be
Yeah.
a COVID headache. How do you differentiate that?
COVID has now been known to have various manifestations. Various
Mhm.
systems may be involved.
Mhm.
Headache per se is a symptom of COVID only very, very rarely. It is like
Mhm.
14% of the times patients present with headache. But
Mhm.
in addition to headache, these patients will also have other symptoms like he will have snuffles or cold or
Mhm.
cough or fever, respiratory breathing difficulty. So if the headache has been same over
Right.
a period of time that he had as previously, a typical chronic headache,
Mhm.
without these symptoms, then he
Mhm.
most likely has his chronic headache or migrainous
Mhm.
headache. If in
Mhm.
addition there are symptoms of fever, cough, breathlessness, malaise, then
Mhm.
yes, you need to think about COVID-19 infection. But it is
Right.
we are seeing them as pretty rare, 10 to 14%, not more than that.
Right, right. I think COVID also, not just with the headache, I think it manifests into more neurological conditions also. I think
Yes,
that's
yes,
what we are
definitely.
reading nowadays.
We have seen a
Um,
lot of patients who have had post COVID, say within 4 to 6 weeks, we have them coming, seen them coming with strokes or
exactly. Right,
encephalitis
right.
or delirium or neuropathy. So we are seeing them something known as
Mm-hmm.
GBS or a facial
Mm-hmm.
palsy. So we have been seeing this different myriad manifestations of COVID in neurology.
Right, right. Great. So, I think just one more question that we would like to, I think this question is very interesting because when we say silver lining, it's hard to admit that, oh, great, I have migraine or I have headache. What is the silver lining here? Maybe that pushes people to get more regimental or, actually understand that, it's like an alarm, do
Yeah.
something about it. So, what, according to you, your patients feel that, a silver lining could be to migraine?
See, what I have experienced in practice is people are very fascinated with labeling of a diagnosis.
Oh,
So people
okay.
are happy if they have been labeled as migraine because
Okay.
they now know that they are suffering from some condition which is in the books. So labeling headaches is as migraine is good because people are satisfied,
Mm-hmm.
but you all have to understand that migraine is not a life-threatening condition. It is not
Correct.
something which will cause immediate danger to your life, but yes, it increases morbidity in terms
Right.
of it decreases your working efficiency, and
Mm-hmm.
people who tend to have repeated attacks of migraine may sometimes have depression and may
Mm-hmm.
land up with suicidal tendencies. But you have to remember with daily no, having a strict or a proper schedule in your life and
Right.
having good prophylactic drugs as prescribed by a neurologist will
Mm-hmm.
help you overcome the label of migraine or a decrease in intensity of your headaches.
Right. Perfect. I think this was a great, conversation that we had regarding migraines and headaches. I think it's important for people to understand this from a very simple perspective, especially, when we go to doctors, there's a lot of technical terms involved, and there's so much information on Google that is kind of it's so overwhelming for people. So I think this should really help them get a bit of a clarity towards
Yeah.
this kind of disorder.
One thing
So,
I would suggest, people
yeah.
always come to us with, they come with typing headache, cause of headache on Google, and the first diagnosis that pops up is a tumor. So most
Correct.
of them just want to get a MRI done to be
Correct.
sure that they don't have a tumor. So this Google diagnosis has led people to think in a wrong way about their overall
Correct.
well-being. So
Correct.
I think
Correct.
should not be doing that.
Absolutely, absolutely. And I think that's the attempt that iCarden wants to make, is to make people more aware of what the problem is rather than, self-medicate or just Google symptoms, because that's not the actual answer to things. So thank you so much, Doctor. This was a wonderful session, and we will connect with you soon for our next session shortly.
Yeah. Thank you. My
Thanks
pleasure.
so much. Thanks so much.